It's interesting that despite affecting millions of people worldwide, lupus is still relatively unknown compared to many other chronic illnesses, even autoimmune illnesses.
You know, because most times, because it's a chronic condition, you're in and out of hospital. But the emotional part of it and the psychological part of it needs care and attention too. And carers need to be conscious of this, and they need to understand that it's an all-round care that is required, not just medication.
Okay, now from your work at the GLF Foundation, what are some of the biggest challenges people living with lupus face when seeking healthcare in Nigeria? I ask this because listening to one of the persons at your event, she said her happiest moment was when she was finally diagnosed. It didn't make sense.
Yeah, thank you. Absolutely, yes. So that is one of the biggest challenge. Delayed diagnosis. Delayed diagnosis is one of the biggest challenge of people suffering from lupus in Nigeria. And that delayed diagnosis then leads to so many other things. It's what causes the damage that then leads to death. You know, because the longer it takes to diagnose correctly, then that patient doesn't get the right treatment. And so therefore a lot of damage is done to several organs, and this is what leads to, you know, death eventually. So I would say yes, that's one of the biggest challenges. The second one is the shortage of specialists.
Right.
Yes, we don't have enough specialists around lupus. You know, lupus patient needs to be managed by several specialists, like the neurologist, the cardiologist, the nephrologist, that's the kidney doctors, yes. You know, so all these doctors are in short, you know, supply in Nigeria. And therefore, it takes long for a patient, and sometimes they are not just available at all to see them. So that's a big challenge. And then also limited awareness among healthcare providers is another big one, you know. Like I earlier said, you know, when I talked about what healthcare, your very first question, you know, we're talking about what is the role of healthcare. And then if there's not enough awareness among these healthcare professionals about what their role is, do you understand, then you know that lupus patients are disadvantaged. You know, so another thing is the high treatment cost. Even after diagnosis, the treatment costs are high. It's not easy to treat lupus. The drugs, you know, at any point in time, the number of drugs that a lupus patient has to be on is maybe like 6 or 8, you know, and these drugs cost money, and you have to continue to take them in order to keep your flares or your symptoms under control. And so most of them stop taking drugs because they cannot afford them, you know. So high treatment costs, because there's no subsidized treatment plans for lupus patients. Most of their drugs are not even covered by the HMOs and the Federal Health Insurance Scheme, NHIS. So because it's not covered, they have to self-treat, and it's not always easy for them. And finally, stigma. I cannot mention challenges without talking about that, because there's clearly a stigma around the disease lupus. Because what is misunderstood is, you know, once you do not understand something, the people who suffer from it are now ostracized from society or looked at as there's something not right about that. So people stigmatize them. Yeah.
So we want to humanize these issues. And for me, I would like to find out, from your experience with these persons living with lupus, what are those stories they share that are being stigmatized? I'd like to know what stigma, how are people stigmatizing them? What are they saying?
Okay, so now a recent case was someone who came to me who heard about the Lupus Awareness Launch and said to me, wow, incidentally, a colleague of his in the office and his staff had told him recently that she's suffering from lupus. And he was hearing about that for the first time. And he was like, what's that? Do you understand? So he now told me that in his mind, he's just thinking this lady is just, not ready to work. And so he put her in a category of being lazy and pretending to be sick all the time. But because this man, he had a compassionate person, otherwise, someone else would probably not even care. He met this lady actually crying a number of times in the office and was wondering what exactly is this sickness? Do you understand? Because I can't see anything wrong with you physically. Of course, when she's really sick or maybe having a bad flare, she'll probably be in hospital, so he won't see her. But when she comes back to school, constant fatigue is not something you can physically see is wrong with someone, but they are fatigued. Constant pain, they are in pain. You can't see the pain, but they are in pain. Do you understand? So if someone day after day is telling you that I am tired, I am fatigued, so the thing is that this lazy person or they're pretending. Do you understand? Then another instance was when, in my own experience, my sister, when she had her symptoms, some of her symptoms were like she would just break out in sores all over her body, and sometimes parts of her tummy will be bloated, like she just blows up, her entire body just blows up. Do you understand? So you just like as though she's been pumped with maybe like a balloon pumped up or something, so like water retention, she suffer from that. And so in her part of her husband's part of the country, if you present with a swollen tummy and swollen legs and all those kind of symptoms, they say it's because you've been unfaithful to your husband. So she was stigmatized by her husband's family as a woman who was being punished for being unfaithful. And she was required to come and confess so that she can get relief from her symptoms. So these are some of the stigmas.
Wow. I understand that lupus can appear like other illnesses, and what are the red flags that health workers should look out for?
Chest pain,
Right.
joint pains, and unexplained fevers, and sudden. It comes on very suddenly, unexplained. Do you understand? So most times when you present with fever in Nigeria, you keep being treated for malaria, But that's why I'm saying that the healthcare provider should maintain a high index of suspicion. Your patient keeps coming in every week or every other week with malaria. Be suspicious that there must be something else other than just malaria, because you keep testing, and for the average Black Nigerian or Black African or Nigerian person, at any point in time you test for malaria, you will see at least 1+.
That's right. That's right.
Do you understand? But when it doesn't mean that it's that malaria that is actually making the person sick. Do you understand? That 1+, that tiny. Because when you begin to see a pattern of constantly, unexplained fevers, chest pain, body pain, fatigue, unexplained fatigue, do you understand? Mouth ulcers, just breaking out in mouth ulcers, and it keeps recurring, things like that. Just notice the patterns. So my appeal to healthcare professionals: notice the patterns, recognize those patterns of symptoms, and take note of them, and then suspect lupus and do the test. At least if it's not, then you can rule that out and you would have saved a life.
Right. Suspect lupus and do the test. If it's not, then you would be saving a life if you did that. What's your call to action for hospitals and health workers? What can they implement to ensure proper management of lupus from your experience?
Well, I would want to see a health system in the country, in Nigeria, where hospitals invest in lupus awareness campaigns. Let hospitals themselves begin to train their workers, their doctors, their nurses, to look out for these symptoms. So I think that would be, to develop clear and then develop a clear referral pathway. So even if you start with a nurse, maybe you just start when to go and see a nurse, because you're complaining of pain, let there be a clear referral pattern from that nurse to the doctor, to the specialist, you understand, to do the diagnostic test and all that. Don't take anything for granted, and then also ensure that patients receive, you show compassion for patients who keep coming with the same symptoms. Don't get, to a point where you think your patient is just, their wahala is too much, that they're always sick. They're always coming with one fever or pain, headaches and mouth ulcer. If it's not this one, it is that one. No, show some compassion and in fact, going forward, it would be nice to have like they do in more developed countries like the UK and Canada and the US, where they do have like a proper lupus centered care, where they train healthcare professionals to specialize in lupus care, lupus patient care. Do you understand? So, because like I said, the lupus patient is in a different category. Because it's a lifelong disease, they need to be managed. There needs to be like a care program specifically developed with trained healthcare professionals who understand how the treatment aspect of it, as well as the empathy, the compassion, do you understand, support and guidance over a long time. So
yeah, I hear you, but we should also remember and realize that there are lots of challenges. A few persons living with this condition may not maintain one doctor for many reasons. So before we close, I'd like to hear how you speak to some of these challenges. So for instance, you said when patients go to their doctors, doctors should keep a record so that some trends, some patterns are attended to, right? But here is the challenge. Because you know that your health worker would show some patient fatigue, right? Sometimes you have that fever for many reasons. Out-of-pocket payment, distance to go to hospital, the reaction of your doctor to you. We just go to a pharmacy, buy drugs, and that's it.
Oh, self-medication.
Self-medicate, right? So that's another point of call. What do you have to say to people themselves who may be having this prolonged symptoms by themselves?
Obviously, Alu, that is a whole topic on its own, self-medication and the effects of self-medication on people's health. We could do like a whole 12 months of episodes on just that topic alone. It is so common for various reasons that you have mentioned, because people can't afford proper medical care, so they will rather resort to self-medication. If you have a condition, if you stand any chance of surviving a condition such as lupus, I want to advise you, do not self-medicate. If you notice any of these symptoms that we're discussing about on this podcast, please, if you have been self-medicating, I advise you, I plead with you, go and see a doctor and ask to be tested. And I'm saying this because it's doable. At the awareness launch, one of the special advocates that attended said to me how she literally self-diagnosed. How? Because she kept going to her doctor with these symptoms, and the doctor was not able to tell her anything that was wrong with her, to give her a diagnosis. And then one day she was reading something online about lupus. And then she saw that all these symptoms that were listed, I think she must have seen it on social media, that this is her life. And so she went back to her doctor and requested the specific test to test her for lupus. And lo and behold, the results came back positive. And since then, she's been receiving the right treatment. And so she was able to catch hers early because she paid attention to her health. Do you understand? So imagine if you are self-medicating and you are not even paying attention yourself, but you feel that, oh, ibuprofen or Panadol or malaria treatment or even typhoid treatment you can get off the counter, is enough for you, then it means that you're doing more damage to yourself and you have zero chance of a proper diagnosis. Do you understand? So I would advise totally against self-medication. I would encourage people showing some of these symptoms, even if you have not had all of the symptoms that we are managing, but you notice that maybe you keep having one or two of these symptoms repeatedly, just go and see a doctor.
Right. For some people, for the challenges we've mentioned, they may not be able to go and see a doctor. Is there a way they can reach out to the Gift Lupus Foundation?
Yes, the Gift Lupus Foundation is here to create awareness about the lupus. That's to make it visible through podcasts such as this, as well as we educate the public on what lupus is and how to manage it. We support people living with lupus. So if you suspect that you might have lupus and you cannot afford to do the tests, you can reach out to the Lupus Foundation. We will access you on a one-on-one basis, and then we see if we can support you.
Right. The details of how to reach out to the GLF Foundation would be scrolling. And so please don't forget, send us a DM, send us a message, and you would be sure to get support. Our guest today has been the founder of the Gift Lupus Foundation, Dr. Lovett Ononuga. Thank you so much.
Thank you. Thank you, Alu. Thank you so much. It's been
Thank you. Thank you for the incredible work you continue to do through the GLF Foundation, because this gives a lot of awareness and it improves the lives of people living with lupus, something that hasn't been available, So lupus may be invisible to many, but the experiences of those living with it are real. And we better know. In case you're one of them watching us, we feel you, we hear you, and we are here for you. Greater awareness, earlier diagnosis, compassionate care, and stronger support systems can make a meaningful difference. Let us all play our part in creating a more informed and supportive society for people living with lupus. Click the link below to subscribe to the podcast and follow us and get more information on everything lupus. You can even send an email or even a call. We'll be happy to receive you. This has been another episode of the GLF podcast. Thank you so much, Dr. Lovett.
Thank you.
Founder of the GLF, being the Gift Lupus Foundation. My name is Alu Azege and I'm your host. I'm excited to have you here. Keep a date with us, follow and share so we can spread the word. Thank you.
Thank you. Bye.